One TV special report.
So why is sexual health important? Aerobic exercise that improves circulation and works at heart. Endorphins released during orgasm can, well, they say chronic backache can treat backache and arthritis. Next. So sexually active people we're talking of sexually active people that are practicing safe sex, okay? So they are very happy, basically, no? Just to summarize everything. Murag lami kayo magpamahaw ang asawa, lutuan yun, no? So happy kayo. Kung mayo ang performance, lami ang pamahaw, lami ang coffee. Next, please. So, erectile dysfunction, the consistent or recurrent inability of a man to maintain or penile erection sufficient for sexual performance. Next. So, there are types, mild, moderate, and ED. Next, please. So, again, as we age, of course, ang performance always, nanagay na affect gamay, maapektahan na. Next. So, 1 in 10 Filipino claim they have problem with getting or maintaining an erection. Next, please. So basically, that's the organ, or those are two dagko kay nga blood vessels when that it erects, diha mo ato ang dugo. So mura gina siya. Next, please. Next. This is just the anatomy. Next. So not enough blood flows to the penis, or blood leaks from the penis back into the body. So of course, napunay part sa brain nga maka-affect sa performance. Next, please. So again, these are the very important things that can at least prevent, no? So for performance, you should avoid drugs, of course, prohibited drugs, alcohol. So wala naging inom, sigarilyo, and stress, no? Dapat dili kay ka mas stress. Next. Of course, unfortunately for some, na ay mga diabetic, mga hypertensive, it can also affect your performance. Some people are having depression, high cholesterol, and surgery or injury to the pelvic organs from surgery or very chronic illness. Next, please. So we call them the silent sufferers. No? Of course, with men, there's always the ego. But hopefully after the lecture, you can also share. It's good to share. And just tell us, urologists are full of secrets from men. Next. So, of the men with erectile problem, 1/3 only sought consult. Why? Because of feeling of embarrassment. Obviously, medyo mauwaw. Even mo storya sa doctor, unless medyo grabe na good, they always tell us. And they will always say, medyo tigulang ako, so di na good pwede, but we can still do something about it, as long as it's safe. Next. So it can affect your life, no? This is not prostate cancer anymore, right? This is ED. Of course, medyo mag-uol na, medyo ma-insecure na, and they will always fight with the wife, and the wife will magduda na. They will always ask if nahurot pa sa girlfriend or something like that. So it's still also as equally as important as the other things. Next. Next, please. So mag-uol na, no? From an image of a macho man, then, luya na, so it can affect the relationship. Next. So we have medication changes, lifestyle changes. We have so many options for this. Next. Okay, next please. It's okay. Well, again, for people suffering with hypertension, diabetes, it still affects the performance. And very important is when you have maintenance medications and you want to consult about your performance or your erectile dysfunction, it's always important to give your urologist a list of all your medications. Dili gyud magpataka og inom og bisag unsa. Okay? Next. So, of course, you quit smoking, mild to moderate exercise, and of course, stop drinking and good sleep. That can affect. Murag mas naminaw mo ani kaysa ganina. So, please remember this one. Okay? Next. So, kung masubraan po, kung performance, dili na siya normal, ha? You have to run to the ER. Now, prolonged erections require immediate medical attention. So again, before starting any treatment, please consult your doctor, urologist, or whatever. You always give us the list of your medications for us to evaluate kung kaya pa ba sa tambal or di na gyud kaya or masakto og plaster ang mga tambal. Next. So again, it affects the partners too. So medyo dili kay lami ang breakfast na i-prepare sa imong wife, no? Ang coffee medyo pait-pait. Unlike if guwapo ang performance, no? So next. So we have medications. I think it will be given later for those who will consult. Next. So please be careful, no? It can happen. It can cause mga deaths. So that's very dangerous. Next. Be careful, no? Sa inyong ginainom, ha? Alright, so next. So I will explain more. Next na lang, ang mga tambal na siya. Okay, so after that, nani, no? Next. Okay, so, well, ganing a nurse, nani sa Faith Hospital. Dili ni ma-pirate, mura na siya makapaong. Alright, so thank you, no? So that was the last part of my lecture. I hope you learned something.
Okay, salamat kayo, Doc. So, if you have questions, na may mga concerns, na may gusto nga i-share sa gidiscuss ni Dr. Feliciano earlier, now is your time. We will now be having the question and answer portion, the open forum, and of course, on behalf of Councilor Attorney Maris Tapayan, we will have Mr. Nanding Dumanhog to serve as a moderator. Sir Nanding.
Hello. Okay, salamat kayo. Mayong hapon sa dan, good afternoon to all. You were so very excited to to throw your question. But before going further, I would like to determine your honesty. How honest you are. Hingon to si Dr. Gaganiha na kanang problema sa prostate makakos og erectile dysfunction ba? Oh. Be honest. Kisa may kuan, dili na mo function.
Muadto na sa akong clinic. Muadto na sa akong clinic na sila. Off office hours, muadto sa akong clinic.
Be, ang mga asawa, be honest, be. Okay pa ba ang function ni Mister? Oh, no, okay. Okay. Sige. Ato na ta sa atong question and answer portion.
Yes.
At gamay lang ako na role na doa. Question must be germane to the subject matter. Una na ta mo hatag og next question kung na discuss kung na kompleto na pag-answer sa question. Okay? Para dili ta magkalandrakas. Okay. First, to ask. Ma'am? Ma'am Gemma?
Good afternoon, Doc. I'm Gemma Gomos from SM Lao, OPD Nurse. Naalang ko pangutan na para makabalo ko kung saan na po ako itubag sa mga pasyente pohon. Mag-open me pohon. Usually magud sa una kana bitong dai mo duol na mo nga ma'am na ako'y prostate na di ko katubag. Kana bitong di ba ingon mangug ka mention mangug ka nga erectile dysfunction. Sa tupa di na mugahe ang tintin. So, ito pa luyat-luyat na. So, kung sa may mahitabo sa katong sperm cell, so dili ba siya po kompleto kay mawala man yung nutrients, no? So, doon na may posibilidad nga maburos ang iyang partner?
Kung dili na mo tindog?
Oh, yan ang mo
okay.
tindog.
Mas interested yun mo sa erectile dysfunction nga topic, no? No, I'm just kidding. Technically speaking, if dili na gid mo tindog, medyo lisod na gid because by anatomy, ang erect penis manggod ang mo hatod gyud og tarong sa similya. When you say erectile dysfunction, it's mostly dili lang siya mo erect. But the quality of sperm, dili nimo ma-determine if bisan pag na siya erectile dysfunction but the quality siyang sperm is good, yes, he can still makahimo pa siya. Yes, but he needs the erect penis para mahatod niya ang sperm. Yes. It doesn't follow nga if wala na mo tindog, pati nag-sperm. It does not follow.
Okay. Ang kanang prostate nga CA, wala na gyud na, no?
What do you mean wala na?
Kanang dili na gyud siya totally wala
No.
na siya.
Don't get me
gyapon.
wrong. The erectile dysfunction, different na siyang problema. But the prostate cancer, not all prostate cancer patient nanay erectile dysfunction. Okay? even na ako'y personal mga patients, they're still very, very active. As I've said, if you just follow the treatments, if we can at least stop the spread of the cancer, yes, medyo matimplahan pa po siya lami nga coffee siyang wife. I personally know some here sa OZAMIZ, they're still okay. Yeah. But that doesn't follow though. Even with an enlarged prostate, that doesn't follow nga na siya erectile dysfunction. Napuyuban nga dili pa kayo dako ang prostate or they don't have any problems with urinating. They're young, active, guwapo, macho, but they're having problems with erection. As I've said, munang ni-appeal na lang ni because murang nagka-common man gud siya lately, so it can affect them definitely psychologically, of course, their relationship with their partners and wives. But again, not necessarily if you have prostate cancer, you have ED.
Thank you, Doc.
Yes.
Okay, ma'am, salamat kay ma'am. That is very important subject matter,
Yeah.
Doc, no? Kining may tungod sa dili na mugahi ba? Okay, kana importante. Ito, something funny, but dagagay nga na problema ba ini? Usa ni sinungdan kung magbulag ang asawa o ang bana, di ba? Is it right? Kay di na mugahi. Kinsa pa may mangutan na mahitungod aning dili na mugahi? Tindog. Sige, sige. Mintras naas, doktor. Dok,
Yeah. We have, nalibog ko kung Prostate Cancer Awareness Month ba ni or Men's Health Awareness? No, it always happens in the lecture. Mas interested ang mga tao sa performance, generally speaking. Naay daghang tambal no, for that. But again, daghang kay tambal yun. Before we give the medication, we will still, of course, advise for lifestyle modification. No? Again, no alcohol, no smoking, good sleep, mild exercise. Dili kinanglan mura kag moapil og triathlon. So mild exercise, walking, a little biking. Before we give the medication. If di na madda sa lifestyle modification, then we give the medication. There are so many. So many. But again, very important, if you go to me or you go to Dr. YROG-YROG, Dr. Kaday, Dr. Pearl, we have to have the list of all your maintenance medication. Because it's very dangerous na masagol nga tambal, magka-problema gyud mo. And I discourage na mag-inom bitaw ka ng mga online, ka ng mga they claim nga dili FDA approved. It's very, very dangerous. Yes, naitambal. To answer your question, Daghan.
Dok, daghang salamat, Dok. Oban, maulo mo dool ni mo, Dok. I-chismis mong good.
I know. Walay prostate cancer nga. Walay prostate cancer nga question.
Bitaw. Okay, another one.
Go ahead.
Sige, ka to, sige.
Hindi na mugahay ba? Ano kung mga symptom sa prostate?
Dili, not necessarily. Ang prostate, as I've said, appeal gina na kay prostate. Kita na ng lalaki na prostate. Ako na ko'y prostate. Tanan yun lalaki na prostate. Akong gidiscuss is, kanang nanay problema ang prostate. Moto ang common is ang pagdako. Di gina mapugnan sa bisag unsa. Mudako gina because of our hormones. Muna natay bation. Ang katong sa kanang pagtindog, lahi po na atong investigaron nganong dili na mo tindog. But dili necessarily nga kung dako kag prostate di na mo tindog.
But there is instance nga kung doon na kay problema sa prostate, o sana sinungdan nga dili mo tindog.
Not necessarily. No, there are problems ang nalay tambal nga part sa pagpagamay sa prostate ang makawala og libido. Medyo muhinay ang gana. But that doesn't mean dili na mo andar.
Okay.
It's totally different, It's totally different.
Dari ko ni Donald.
Doc, good afternoon, Doc. Since kanina, Doc, discuss about sa ihi, no? Frequent kwan. Ang akong pangutana, Doc, nag-inom man tag 8 glasses a day. Successive, di ba? Ako, sample, nag-inom ko kwan yun, tubig. Dayon, sa pag-inom na ko, Doc, sige ko mag-ihi ba? Normal ba na siya nga magsige drink of water o sige pangihi?
Yes, that's a very good question actually because that's very practical. Yes, as long as imong flow wala bitaw gabara, pag ihi nimo inom ka daghang tubig. more or less pariro sa imong gawas. As long as pag-ihi nimo dili pa ka mangusog, pag-ihi nimo more or less mahurot gud siya. Then mag-ihi ka, medyo mulayo pa imong pananaw, dili pa sa chinilas, medyo layo pa gamay. That's fine, that's fine.
Normal, yeah.
Imong giinom should be magawas po, majority should be magawas. Ang usually common sa na prostate problem is medyo hinay na, di na kayo kakatanaw sa layo. Pag-ihi nimo, uy, murag na mabilin, taod-taod, kayo na pug ka, or medyo hinay na gyud ang pressure. Diha na ang medyo magduda ka nga nanay problema sa pagdidako na imong prostate, ka mga 40, 50. But that's a very good question. No? It's okay. It's okay basta mangihi ka.
Okay. Thank you, Dok. Thank you, Dok.
Okay.
Sir, question.
Roy,
Doc,
Yes, go ahead.
Ako ang pangutana kaning kung mild stroke ang laki, tinuod ba wala na esperansa?
Walay.
Wala na esperansa, wala na ikabuga.
Doc, lain na din ang prostate.
Yes, of course. It can affect, no? Kung na mga stroke, of course, majority yun sa ga-control sa atong lawas, especially sa atong pangihi, sa erection and all, majority sa ulo man yun. So yes, tinuod, ma-affected yun. Kana medyo subidahon yun ang pagsulbad, but yes, it can be affected, definitely.
Doc,
Walay prostate cancer.
Doc, good afternoon.
Yes, go ahead.
Doc, di ba ang prostate cancer na ay pwede man mo agad medication?
What's ito?
Ang prostate cancer pwede mag-medication lang?
Yes.
Pero kung dili siya madala, Doc, operahan siya.
Okay, very good
Then,
question.
kung operahan siya, paon ba tanang prostate or pwede ba nga white prostate po ang laki? Mabuhi ba? Okay ra ba?
Very good. So, okay, as I've said, ang option na ang prostate cancer, na itambal, na injection, na po'y opera kay surgeon man mi. We're urologists but we're actually also surgeons, no? We only do surgery sa prostate kung medyo confined pa siya sa prostate. Dili pa kayo siya nakakatag sa tibok lawas. Nami bagong guidelines nga kung dili lang weight-bearing area sa bukog nga dili pa kay kanapit mga batang, lumbar area, pwede pa may mo opera. Kung willing ang patient mo undergo, we remove the prostate and the surrounding structures. Always ginaapilon ang lusay-lusay. We call that radical prostatectomy with lymphadenectomy. Why? Because it's very common for the prostate cancer to spread sa lusay-lusay. Pero kung nikatag nagmaayo, dili na kayo beneficial ang surgery. Ano man, bisag kwaon na to na ang tibok prostate ug lusay-lusay, nakakatag na sa bukog, sa atay. So diha na mo go in ang mga radiation therapy, mga injection, or for some patients, hindi na ganahan mo undergo very big surgery. And then yes, that's correct. We can still be alive without a prostate.
Another question?
Doc, is it considered as disability ang erectile dysfunction?
Well, honestly, I haven't. I cannot answer. Sorry. I don't know the definition of disability.
Ako mong ang focal person sa CSWD, so kanang usaman siya sa naglimit pod ba sa function sa usa ka male nga dili naka normal ang iyahang function. So naman gud po yung mangutana sa ako nga mga uban kung is it considered as a disability kung doon na kay erectile dysfunction.
Sorry, that one I really cannot answer. I'm more of the medical side only, the medical aspect of erectile dysfunction.
Okay.
Sorry.
Say, thank you, Doc.
Doc, thank you. Anybody? Isa ba? Oh.
Good afternoon, Doc. Panalita, wala katong isikutan mo sign and symptoms sa naidepikto sa kuan kanang prostate. Mangutana lang unsa na to pag-maintain ang ato ang health nga healthy kanunay ang atong prostate. Unsa mga pamagi?
Okay, that's a very good question and a very common question. No, as I've said, ang pagdako mangod sa prostate is part yun sa pangidaron sa atong mga hormones, no? So actually for now wala pa giingon nga maka-prevent. We only encourage for the iihi kana mga to avoid caffeinated drinks. But that's not proven nga to prevent mo dako ang prostate. As of now wala pa tambal nga makapadili mo dako sa prostate. We just have to detect the problem early. We give the medications early. We give the early treatment para dili mo abot sa point na mag-catheter, na makadungog man wala, di ba, masapsapan ng prostate, nagdugo ng ihi, naglisod na yun, nag-catheter na for a long time. So for now, we are only advised to avoid caffeinated drinks, but no treatment or kanang remedy nga makaprevent magdako sa prostate for now. That's always part of aging sa men. Again, there's no relation between overuse, underuse, and no use. No, that's one of the reasons why dili magpakonsulta ang mga lalaki because kinsa maging kahadlukan nato sa tanan. Same kahadlukan. Ang asawa magyud, no? So mahadlok kita sa tong asawa kay magduda dayon. No, so most of my patients magpakonsulta sa prostate uban gyud ang asawa. And then magtanaw gyud sa akong naong kung anong nagkadako ng prostate sa akong bana. Murag gusto gid niya istorya nako ba murag always, almost always. So that's not true, ha? Mudako gyud at the age of 40, 50 up.
Okay.
Yeah.
Doc, thank you. Honorable Long.
Yes.
Good afternoon, Doc.
Good afternoon.
Feliciano. During your lecture, you stated that overuse will not cause prostate problem. I have read an article a few years ago which state nga, nag-mention siya nga, if you allow your semen to stay long in your body, there will be a chemical reaction that probably will cause prostate problem. Is that?
No, that's not true. No. In fact, kanang sometimes ilang kanang bitaw mga wala bitaw activity, no, mga trabaho sa society nga wala activity, why sexual activity, that's not true, no. Ang growth sa prostate is always part sa atong hormone. Part gina siya, mudako gina siya. Not true for me. Wala may sa among guidelines for that.
What I mean, Doc, is this. If we allow the semen to stay in our body, magpabilin bitaw sa atong sa atong testicle ba na siya, ang hold sa atong semen. Kung dili na siya ma-discharge, may ejaculate, na a chemical reaction sa atong body, that will affect our prostate. In fact, what I've read, they encourage male to have sexual intercourse with their wife if they're married, or they have to ejaculate so that those semen will be discharged so that it will not affect the prostate. So I don't know if it's true or not, but I read that based on the research made 2016.
Well, I have to verify on that, Councilor, pero for now, I think wala may guidelines that says it can trigger nga mudako ang prostate. No, it's as I've said, usually mudako ra gid na siya whether you're sexually active or not sexually active. It just goes with age. Nalay uban gyud maswertihan ang pag-grow sa prostate, di ba? Lingin. Nay uban maswertihan nga dako siyang prostate pero pakilid ang gawas. Ang uban gyud pasulod. So, not all dakong prostate tambalan. Okay? I will verify that, pero so far, Councilor Murag, wala pa. Whether you do sex regularly, masturbate regularly, or not do it at all, still mo dako ang prostate sa lalaki.
Okay.
Yeah, that's just part. Even me, as a urologist, mo dako sa dakong prostate.
Another follow-up?
Doc, good afternoon. In relation to the questions, previous two questions, Doc, do you have any recommendation with regards to oral medication that we can take so that we can fortify or strengthen our prostate gland?
Okay, as I've said, as of the moment, there are just claims na theories or claims that, well, they prevent prostate cancer, but for our guidelines in the PUA, we don't have something or tambal nga makaprevent og dako sa prostate. What we can offer is, of course, we detect it early, so we start medication early so that dili mo abot sa point that you will have complications, no? So if complications, what I mean by that is, dili magbalik-balik ang UTI because magpundo ang ihi. So, paluagon natin yung agianan sa ihi, pagambyo ng prostate para guwapo ang flow sa ihi, dili magka-UTI, dili magpundong ihi, magkabato. But wala pa gid siya ang what we always give advice to avoid caffeinated drinks, but wala gid tambal as of the moment nga moingon nga maka-prevent nga dili mo dako ang prostate.
Anybody?
Yes.
Doc, good afternoon, Doc. My question is, sakto ba, Doc, regarding on Doc, masturbate, Doc, nakakabawas ba ng risk sa prostate cancer?
What's ito?
Regarding
Come again.
masturbate,
Can cause
Masturbation,
prostate
sir.
cancer?
yes, Doc.
No. No relation between masturbation, frequent or not doing it at all with prostate cancer. Prostate cancer is always genetic and very linked to smoking as of the moment. But no relation to ejaculation.
Hello, okay. Medyo hinay ng battery. Anybody? Wala na? Klaro na tanan? Napa?
Very good crowd actually. Very active. Sige na pa.
Ikaw? Okay. Si Rondong.
Doc, kanang aside sa sexual intercourse, Doc, sa ginaingon ni mo kaganina, sa pag-inom o mga kuan ginabawal, doon na pabailaing mga hinungdan, Doc, na nagka-prostate cancer ka aside from dili na ka mag-sexual intercourse, dili kaayo, wala ka nakig-sexual intercourse, adunay sakit nga babae or kanang pag-inom-inom, naabay lain pang cost aning prostate cancer, Doc, nga basig wala na mo mahibal-iba nga mo ni hinungdan nga nagka-prostate cancer mi.
Okay. Ang sex dili gid na maka-cause og prostate cancer. Ako lang klarohon, whether nag-masturbate ka, nag-ejaculate ka 10 times a day, you have sexual intercourse 8 rounds, what? Dili gid labot lahi gid ang prostate cancer. Ang pagdako sa prostate cancer part of aging. Ang katong paghubag, botoy dili po to siya permig sex, natakdan lang kag nay bisag once na mo nag-sex pero nay infection ni hubag. Ang prostate cancer is totally different. Usually, ang cause by research is genetics or na-pass on ka ng mga genes like any heredofamilial disease. And for now, the most proven is smoking. No relation between your sexual practices, how often you want to do it with, no relation. No? It's always genetics and smoking. So, ang mga smoker, no, it's up to you. No? Mo lang gina siya. But no relation between sex and prostate cancer, definitely.
Napa? Napay mangutana? Okay.
Active kayo.
Good afternoon, Doc. My question is, makatabang ba, Doc, there are medications para sa kani prostate nga makatabang daw og kanang bitaw mga sa atong stone, Doc, atong kidney stone. Kaya di ba na may medication nga if mo hubag atong prostate, di ba mo dilate man siya na medication nga mo pa-dilate para mo makaagi. So maka-help pa na siya, Doc, if na kay kidney stone ma-excrete ang stone.
Okay, that's a very good question. No? I think mo gunay problema no sa pharmacy. They always say, "Why are you taking this? Or you have prostate problem?" So yes, that's correct. The alpha blocker katong ganina akong gipost, tamsulosin, terazosin, muna sila'y mo paluag sa agyanan sa ihi. That can be used also kung ang bato nimo sa kidney or nasa ureter. Katong sa drawing, if you can remember, kidney din ay tubo. If magbara ang bato sa tubo, paluagon nimo matagak ang bato. Yes, that's true. We use those medication not only for prostate nga makakusog og flow, but also to if ever there's a blockage in the ureter because of a ureteral stone or bato sa ureter, we use it to dilate the ureter para matagak ang bato. Pag maluag ang tube, then of course the stone will fall down. So yeah, that can be used simultaneously with prostate and ureteral stones. That's more common in the ureteral stones. We use it that one.
Thank you, Doc. Wala ni mangutana? Okay na pa. That will be the last, probably.
Okay.
Kung wala ni mangutana?
Balik ko, Doc.
Okay.
Kano sa ang gyud ang eksakto nga panahon nga kinahanglan kami mga lalaki sama nimo nako nga kinahanglan natam konsulta sa doktor?
That's a very good question. No? Again, at the age of 50, 50 anyos, tanan lalaki, bisan pa og babayi ang kasing-kasing, pero lalaki sila physically. No exemption, no exemption. All male physiologically should have a basic urology consult at the age of 50. No, so some might think it's with you, no, so the prostate. But if na a family history of prostate cancer, it should be earlier. Dapat 45 magpa-check na gyud og urologist or any doctor for that matter. Again, I should emphasize on the importance of digital rectal exam or quote sa lubot. No, that's not a joke. That's a very important, a very simple physical examination that can help the doctor a lot. So, rectal exam, it's just barato. One gloves, one finger. Duha day, sorry, kay mabuslot niya. Isa pa nga gloves, sorry. Katawa si Dr. Kada, you know. So, we use 2 gloves kay mabuslot niya pagkuot, delikado kayo. No, so KY jelly and that's it, but it's a very important. All male patients should have a consult with a doctor or urologist, no? All. You should get at least a PSA, do rectal exam, then monitor every year. If we start you with any medication, we usually recommend to follow up every 6 months. It depends. If magduda tag prostate cancer, we monitor every 3 months, but mostly every 6 months and annually. But sorry, recommended annually to have the rectal exam, technically. No.
Doc, i-release ako nga question.
Go ahead.
Ang pila makadoy bayad kung mag-exam?
What's ito?
Examination fee or...
No, that's part of the examination fee. What do you mean? Like, no, that's the rectal exam should be part of your examination, physical exam.
How much?
What do you mean, how much? No, it's part of your consultation to the doctor.
Okay. So,
yeah, it should be.
It's really affordable. No problem. Anybody would like to ask question? Final question? Okay, maluotan doktor. Kung mangutan na pag-iba, ato na naman sa iyang clinic.
lang.
It's okay.
If ever, Doc, ang usa ka tao, usa ka individual, ma-diagnose nga doon na siya ay prostate cancer, pila ka tuig na lang ang iyang pabuton? Or may chance pa siya makasurvive?
Okay, medyo nahadlok na yung mga tao, no? So again, prostate cancer, as I've said, kung papiliyon naman lang yung ba, at least prostate cancer has the most options. Daghan kay option. We have the tambal, the injection, the chemotherapy, the radiation therapy. If you want the surgery, we can do it. Dapat dili mamatay ang prostate cancer o tungod sa prostate cancer. My oldest patient is 91 years old, stage 4. He's still very well alive. Dili good because we have so many options, no? Ay kagul kung mag-diagnose kang prostate cancer as long as we follow the protocol. And of course, dili pud kayo late. Kung grabe na gyud kagay ka late, of course, medyo dili po kayo magdugay. But generally speaking, taas o kung ma-manage lang og tarong sayo mahibawaan ang prostate cancer, daghan kay tambal. Yeah, go ahead.
Okay na. Wala na yung mangutana. Ano pa? Okay. Ma'am, go on.
Kung doon na tayo prostate cancer, unsa may bawal nga exercise? What I mean, di ba, okay lang ang walking. How about heavy lifting? How about swimming? How about jogging? Bawal ba na? O cycling?
Okay.
Unsa man?
I think in the lecture I mentioned about it's very common that the prostate cancer will spread in the lusay-lusay or lymph nodes and also sa bones. So I encourage all my patients with prostate cancer to take care of their bones. Because if ma-fracture ang cancer, a prostate cancer patient with bone metastasis or nasa inikatag na sa bukog, very difficult to treat. Maglabad ang ulo sa orthopedic surgeon. So as much as possible, if you're diagnosed with prostate cancer, not really limit na, they can just walk, but just be careful, dili sila ma-fracture. Because a pathologic fracture is very difficult to treat. Yes, they can do whatever they want as long as tayo musunod. I still encourage my patients with prostate cancer, even stage 4, to walk, to do what they used to do, except nalagi musunod. Na di lang sila matumbang, away mo salo, kay delikado kay. And you will notice that when when there are prostate cancer patients, we always give kanang calcium supplements, no? Para to make, we give zolendronic injection. We also give the Exgiva. That's for the bone. We try to strengthen their bone. It's very dangerous for them to have any fracture.
Dok, daghang salamat na pay mangutana.
Dok, may hapon, Dok.
Yes,
Kana ba, Dok? Ako, Dok, kana bitaw mag-example, magkakuan ko. Inom ba kog wine ba, Dok? Dahil mga 3 days before, Dok, init mang magawa sa ihi, Dok. Init siya ba? Dahil magputol-putol. Sunod na po nga kuan, adlaw, Dok. Awan tayo po. Basta kuan, Dok, mura na, Dok. Dahil maihi po na ko, Dok. Magputol-putol. Dahil lilipit kada kuan. Sige, bagkuan, Dok. Puro wala man siya sakit, gibati. Dok, katulang panahon nga, orang mangihi, orang init siya, Dok ba? Salamat, Dok.
Okay. As much as possible, no, munang among i-advise to avoid caffeinated drinks or kanang alcohol because diuretic manguna. Kabantay mo, mag-inom mo beer, alcohol, mag-ihi-ihi. So sometimes malibog ang doctor if this is because of your prostate or tungod sa imong lifestyle. Coffee, caffeinated drinks, soft drinks, beer, alcohol, wine, sometimes mag-overlap ilang symptoms. So we encourage you to avoid those things para kabantay mo mag-wine, mag-primi, ihi, beer, tanduay, Glenfiddich, Johnny Walker, tanan. So yeah, mas may ma-avoid and then we will see if it was because of the alcohol or it's because of your prostate problem.
Mayong hapon sa tanan. No, dako among pasalamat no si Dr. Dako yung pasalamat pod na active kuno kayo ang mga participants ni hatag gyud og kanang mga pangutana. So, this certificate of appreciation is proudly presented to Dr. John Mark S. Feliciano for sharing his valuable knowledge and insight during the prostate cancer awareness orientation. Just this afternoon, September 29, 2022, signed by our very own Mayor, Attorney Henry Indy F. Waminal Jr., and our Vice Mayor, Honorable Simplicia Bibi O. NERI.
Ladies and gentlemen, atong bakbakan o Dr. John Mark Feliciano. And of course, ato sa bakbakan ang ASENSO OZAMIZ administration headed by Mayor Attorney Henry Indy F. Waminal for coming up with such a remarkable activity. Thank you very much, Doc. Okay, to formally close this afternoon's symposium, we will now have Councilor Attorney Daniel allow for the closing remarks. A big round of applause for him, please.
Our resource speaker, Dr. John Mark S. Feliciano, our acting city health officer, Dr. Maria YROG-YROG, Dr. Kaday, Dr. Machoka, and all the participants in this lecture. We are very thankful that Dr. Feliciano, John Mark, accepted our invitation to share his expertise concerning prostate cancer. And we are very thankful to you, sir, for sharing your expertise to us. We are also thankful to Dr. Maria YROG-YROG for having this lecture or activity for the awareness of this activity is televised. So this will not only benefit who are present now, but also the public. And I hope that our city health officer, under the leadership of Dr. Maria YROG-YROG, will have more this kind of activities, no? Not only prostate problem, but also other kind of health issues. This time, we have problem in hypertension, problem in blood sugar, problem in colorectal, liver problem, kidney problem. So we have so many kinds of problem. And I think it would be right and proper for Dr. YROG-YROG to make recommendation with our city mayor, since we have our own TV program, to make these activities regular, no? At bang ihimong regular, so that this is better, that is, prevention is better than cure. So this affair, these activities, tagaan-tag idea how to prevent. As Dr. Feliciano stated, nga ang prostate wala man gyud non cause. But if possible, dili man ni garilyo, no? Sometimes ang problem sa prostate we inherit from our parents or relatives or something like that. But there are so many health issues this time. They were due to our lifestyle, like blood sugar and other problems. So I hope that our city health, through Dr. YROG-YROG, will make representation to our city mayor, Mayor Attorney Indy Waminal, that we will make these activities regular through the TV program, and it will make our ASENSO OZAMIZ TV program more interesting, and more people will be watching our program. So daghan salamat, Doc. Dr. John Mark Feliciano, for sharing your expertise. And on behalf sa LGU of OZAMIZ, we thank all the doctors who are present here, who participated, and hope this will not be the first and the last, but this will be the first, and we will have more activities like this. Thank you.
Salamat kayo, Personal Attorney.
One TV special report.